right. It's Dr. Hassan Sadri from Newport Beach, California, down here at AAO OIS 2019. Very excited to have my next guest. As you know, he doesn't need any introduction. He's extremely well known. Good friend of mine, Dr. Cal Roberts. How you doing, Cal?
I'm doing great. I mean, this is just so much fun to be here every year, just to see the innovation, to see your friends, to find out what's new, plus to see the kind of clever scientists who are developing some great technologies that hopefully we're all going to benefit over the next couple of years.
Now, you got a unique perspective. I mean, we talked about your career and how well you have both understanding, both because you've serving patients for so many years, but also developing and really leading one of the world's best ophthalmic companies.
Yeah.
And seeing you at the OIS, tell me about what you get out of OIS and what you think, what is the value of OIS for you?
Sure. So I think it's two. I think it's one is a learning. And so one of the things that I feel is my responsibility at Bausch & Lomb is to really know what is happening in the marketplace, really know who's doing what companies are working on what, so that when there's an opportunity, potentially to partner, acquisition, something like that, we've done at least some of the due diligence. We know if this is something that would fit well within what we're trying to do or not. I mean, it's a regular basis. It's a weekly basis that my CEO reaches out to me and says, what do you know about this company or that company, okay? And so OIS really does that. The other thing that it does is an opportunity for us to kind of share our story and let people know the great things that are going on at Bausch & Lomb, the things that we're really proud of.
That's terrific. I mean, you're working on so many things. Obviously, I'm a customer, a big, huge fan of a lot of your products. I've used your IOLs, your meds. Tell us a little bit about three things we were talking about earlier you're really excited about.
Well, I think the three things that I'm really excited about, first of all, starts out with Lumify. And so Lumify is our redness reliever product. In only 1 year on the market, is the #1 seller in this whole area of redness reliever, which is kind of amazing.
Yeah, I don't doubt it at all. It's wonderful.
Consider the products that have been out there for so many years, they're almost household names, and now Lumify is the #1 product in the area, and that's great. And we really have doctors to thank for that, because it's the recommendation of doctors. That for so many years, doctors told their patients to be cautious about redness relievers, that they could cause rebound or hypersensitivity, all this kind of stuff. And now people see that Lumify is a really nice product and doctors are recommending it. So that's great. Second thing that gets me excited is our launch of Lothimax SM. So Lothimax SM is the newest iteration of the Lothimax family using sub-micron particles. Yep. And the idea here is that the smaller the particles, the faster the drug dissolves into the tear film. Faster it dissolves in the tear film, the greater the bioavailability. The analogy I like to make is between a cube of sugar and granulated sugar. If you want to get the sugar dissolved in your coffee quick, use the granulated more than the cube of sugar.
Absolutely.
And that's what we're trying to do with Lothimax SM. We've shown that we have greater penetration in the anterior chamber with Lothimax SM than we had with our previous versions of even Lothimax gel. So that's really exciting. And the third thing that excites me is that earlier this year, actually in July, we launched the world's first toric multifocal contact lens. And so this is really a big deal, because there's always toric contact lenses, there are multifocal contact lenses, and now we have a toric multifocal. And so that's been out now, again, since July, and that's really doing well. So just kind of example of the innovation that's occurring within Bausch & Lomb.
Yeah, so talk about that a little bit, because I know you attend the meetings and you have your hands in a lot of different sort of technologies. What are the things you're excited on the outside that you're looking at that you like as this, either space or specific companies? And number two, internally, give me a little bit of a view of what's going on internally of the pipeline that excites you within B&L.
So I think that what we try to do is try to see how do we think medicine is going to be practiced 5 years, 10 years out. Now, someone like yourself with 2 brand new offices, and the question is, how are you going to do your surgery? Are you still going to do the surgery in an outpatient clinic, or are you going to do it in the office? And if it's office-based, what are we going to have to do from a technology point of view in order to make surgery that's office-based, safe, effective, all the things that we need to do, and cost-efficient. Because at the end, it's going to be cost that's going to drive.
Absolutely.
Okay, so the payers are going to tell us where you're going to do the surgery.
Absolutely.
And so we want to be ahead of the curve. We're for office-based surgery and do that. And also the whole idea of digital technology and using cloud-based analytics for everything that doctors do, from the office, the OR, post-op, everything. And so we're working on that. And so those are my real exciting touch points.
That's terrific. I mean, you have a very unique perspective because you're practicing ophthalmologist in Manhattan for so many years, and then you pivoted over to industry and done so well. It's hard to do both really well like you have in your career.
Thank you.
Part of this, I think, is also giving back data, mentorship, whatever you want to call it, to younger ophthalmologists, younger clinicians, or even younger people in industry that want to follow your footsteps.
Right.
Give us a little bit of insight, a little bit of mentorship guidance. Give us a 1, 2, 3, if you will, on what do you recommend if they want to do that?
Right, exactly. So I think that doctors as a class of people, to generalize it, are a little bit risk adverse, right? And so that if I said to someone in practice, okay, I have a job for you at Bausch & Lomb, you're going to have to give up your practice, and the job may or may not work, so after a year, we may let go of you. And you'd look at me and go,
you're crazy.
Right.
I'm out.
Okay.
Yeah.
All right. So that most people want to stick a toe and then an ankle and try to see, but to keep their practice kind of in the background, so that if it didn't work out, there's some place to go back to. All right. And so that's understandable, but industry is one of those things that's pretty hard to do part-time. And just like your patients want you 24/7, my CEO, he wants me 24/7 too.
Sure.
And it's not those type of things that you could kind of do part-time. So what I tell people who are interested in it is I ask them this question. This is my number one go-to question. And I say to them, how would you rather spend a morning? Would you rather spend your morning putting in new technology IOLs? Would you rather spend your morning designing new technology IOLs?
That's a very good question.
Okay. Because
depends on the morning.
right, but because the point is
Sure.
that what you do is you impact patients' lives, and you impact patients' lives on a big way, but only for a limited number of patients. What I do is I impact patients' lives, but just a little bit, but a lot of people, okay? And so it turns out that we need both.
Sure.
We need those people who impact a lot for a few people, and the people who impact a little, but on a lot of people.
Interesting.
And so when I talk to people, I try to kind of see which one of those
intrigues
they
them most.
are, and then kind of guide them that way.
Sure, that's very good feedback. And things are changing so rapidly, right? I mean, with decrease in reimbursements, you mentioned office cataract surgery, which in my opinion, humbly, is going to be a reality just because of the reimbursements, the nature of the vanilla cataract. You and I both know you can probably do it under oral sedation and done in the office. And I think so much of that is changing. I wouldn't be surprised if there's a lot more people that are going to probably want to impact more lives and kind of get an industry just because of the nature of what's happening. But yeah, it's great feedback. It's always great to see you. I feel like I can spend another 2-3 hours with you.
Oh, we have
fun. Time is limited.
We have fun.
Thank you again. Enjoy the rest of your meeting.
My pleasure. Thanks so much.
It's an honor.
Yeah, thanks.